Hello, my name is Xenophon Babadimitris. I'm a professor in radiology and biomedical imaging and biomedical engineering at Yale. This interview is part of a collection of conversations with experts in medical software from academia, industry, and regulatory agencies, and is supplementary material for a Coursera class Introduction to Medical Software that will appear in the fall of 2021. Okay, our guests today are Dr. Lynn Fiellin from Yale School of Medicine and Bryce Bjork and Ting, who are former students of ours at Yale and now working on a BrainHealth Bootcamp project that we'll hear about it later. Dr. Fiellin is the founder and director of the Play2Prevent Lab at Yale, where they're developing game applications for adolescent health and for public health interventions, and we'll hear a little bit more about that in a video in a minute. Bryce and Ting were students in our medical software class in the spring of 2020, and they actually work on a project under supervision of Dr. Fiellin as part of that class, and that went on to develop into its own, it's taken a life of its own, and we'll hear about that, about their work towards the end of this segment. So with that, we'll first listen to a quick intro video for the Play2Prevent Lab, just so to orient us everybody.
At Play2Prevent, our video games are built by teens and young adults.
For teens and young adults.
To help them live happier and healthier lives. Their voices, their stories, their visions, that's where the games are built from. It is really a collective brain, not work that can be done by any one person or any one of us. It is students, teachers, game developers, scientists. For the development of our video game interventions, everybody brings their expertise.
Community partners can range anywhere from after-school programs to schools. We always start off with focus groups with our students. From that information, we're actually able to glean what information should go into the game, storylines that will be relevant to the kids. It helps us develop different characters that might be in the game.
The greatest part about what we do is having kids design and be involved from the bottom up. They really kind of form a lot of the stories and the narrative.
We'll take the game to our game developers, we'll build out a prototype, we'll take it back to our students and say, is this relatable? Does this work?
So we're passing out headphones so you guys can be totally immersed in the game. During the gameplay sessions, we observe their reactions to the game, if they're having trouble on different levels.
When they play test, they provide feedback on what worked, what didn't work. Teens love being honest and love sharing their opinions.
I like the strategy and the competition.
In this game, you really don't have that much of a penalty, but in real life, you could lose a job, you could lose friends.
The only way that an intervention is going to have impact and meaning is if it is from their voice. A critical part of this work is being able to measure the impact. We conduct randomized controlled trials with gold standard, and we've been able to demonstrate that our games have statistically significant impact on different outcomes that we're looking to measure. So in the short term, we're continuing to build our evidence. In the long term, the key is to really get these games out broadly.
And Lynn, if you can just set the stage a little bit, how did you start this? How did you get into this gaming business? What is the process? What did you learn as you go about it?
So thank you. So it's been quite a journey. So I've been a clinical researcher for about 20 years, and about 12 years ago, it really struck me that that there was a desperate need for prevention efforts for teens around different outcomes regarding their health, their mental health, and their well-being. And at the time, my husband and I had 5 kids between the ages of 9 and 19, and everyone was playing something on a device. And it just seemed that that was a way to capture them where they were, where they wanted to be, to potentially give them a dose of something healthy. So at that time, I submitted a grant to the NIH, which focused on developing and evaluating a video game intervention targeting risk reduction and HIV prevention in young minority teens. And remarkably, the NIH kind of stepped out of its comfort zone and funded it the first time around. And that allowed me to establish the Play2Prevent Lab. That was in 2009. Subsequently became part of the Yale Center for Health and Learning Games in 2015. And so through the last 12 years, we've now developed 5 different video game interventions focused on an array of health outcomes that mostly impact teens between the ages of 10 and 20. And those target things like HIV prevention, substance use prevention, mental health promotion, and so it's been quite an adventure developing this very multidisciplinary team of scientists, of community partners, of game developers, both commercial and what we call serious game developers. And I should really sort of explain what that means, since this is an exploding field, the field of serious games. So serious games are defined as games for a purpose other than just entertainment. So it's key that they be entertaining, because part of the focus of serious games, a major focus, is engagement and using the compelling, engaging aspects of video games, especially with young people. But serious games go beyond that. They really look to accomplish something and set goals so that those goals can then be measured. And so that's what we do at the Play2Prevent Lab. We work with a highly multidisciplinary team, developing these games from the get-go, working with teens. They help us design the game. They help us build the stories, the artwork, the voice. They are really co-designers in the process, while we're also working with our game development team, which has been over the past 10, 12 years, Shell Games, which is a very well-established game development company in Pittsburgh. And so they have been our game development partner. And so it's this sort of relationship between our scientific group, the game developers, and then our community partners, which include, and most importantly, the adolescents, as well as teachers, parents, folks in the community who help us build out these interventions so that they can really successfully target these outcomes in teens. The development process typically can take anywhere from a year to 18 months. It's very involved. It's 24/7. It's highly iterative, back and forth, testing every part of the game as we go along, finally doing a pilot test with kids to make sure that we've gotten everything right. And then we'll then move on to evaluate the game again with that same target audience, not necessarily the kids who helped develop the game, but that cohort that we're really trying to impact. And that typically is using methods, which are considered the most scientifically rigorous in the form of a randomized controlled trial. So we will enroll, 300 to 500 teens, and half will play our game, half will play what's called a control condition, which typically will just be video games with no relevant content. And then we compare their outcomes over a series of different time points, typically up to a year, sometimes 2 years, to see if we can, the goal to demonstrate that there's a difference between the two groups. We have been able to demonstrate statistically significant differences and important outcomes that persist for up to 2 years. So that's pretty compelling. And in addition to that, we hear back from our teen participants consistently how much they enjoy playing the games, how they would tell their friends to go play the games. And that's obviously key, because if you can't get them there and have them stay there, the likelihood that you're going to have any impact or that it will stick is really small. So, so we just completed our most recent game, which focuses on mental health and opioid misuse prevention as part of the national NIH HEAL initiative, which is a close to $1 billion initiative through the NIH to focus on the opioid crisis. And we were fortunate enough to be funded for a 5-year project to develop a new game, which is called Play Smart, that focuses on mental health and opioid misuse prevention, as well as other substance use prevention for older teens in high school. We know that that's a population that is struggling very frequently with both mental health and substance use. And so we just completed that game, and we'll launch our randomized control trial this fall. So it's it's incredibly rewarding. It's great to be able to work with our end users. Hundreds of teams are involved with our projects, and not only to have their voice in everything we do, but then to see the impact that the final product has is so critical.
So thanks. So we should mention at this point that in addition to trying to do all this in an academic setting, you're in the process of starting a company to commercialize some of this work, and maybe you can talk a little bit about that process as well. So how is the life of wearing both of those hats coming for you right now?
So I think what I came to realize is that my lab and my center has gotten the research and development part of things down really well. We know how to develop and evaluate our games in the most rigorous way. But the key is really to get these games into the hands of the kids who will really benefit from them. And that takes a certain skill set and a certain bandwidth and a certain amount of time. And my research team really has so many other things to focus on that it just became very clear that that was not feasible. Now, I have to say that we have to date reached close to 270,000 kids with our games. They're all web-based and one of our games is also on both app stores. But I really think it should be 10, 20 times that number. These games are easily accessible. Kids know how to play games, so there's just not a high bar for kids to engage in these games. They really take no human resource. You don't need a teacher, you don't need a clinician. They can be freestanding. And so the goal is really to get them in as many kids' hands as possible. So on that, and sort of thinking about how best to do that, I co-founded along with my co-founder, Jun Chen, who is a recent graduate of the Yale School of Management, a new company called PlayYBL, which is PlayYBL, basically helping kids become more able through play. That's the idea. And the idea really is that PlayYBL will focus. We've now have exclusive licensing to all the games that we've developed in the Play2Prevent Lab. And the goal is to really get these games out there, through whatever successful channels, whether it's through schools, clinics, health insurance companies, hospitals. I think it'll probably be a number of different methods of reaching kids, but really to have this new entity, which has a fabulous, group of advisors and lots of talent behind it to get these games into the hands of kids in an efficient, effective, and sustainable way. This is not sort of a one and done. We really want this to become sort of part of the fabric of health education for teens, because it is sorely lacking in this country and other, throughout the world. So this is a need that really needs to be met. And I think the digital health tools is one of the ways to really, scale and reach large numbers of kids.
I have one more question, and then Bryce and Ting, feel free to jump in at some point. So I just wanted to ask a little bit. So this is meant to be a supplementary video for a software class, right? For a medical software class. And part of what I'm interested in talking to you about is this process of identifying what your users need. So there's this cascade, right? You have the children and potentially the schools and, the health insurance companies and all the other people who are your users directly or indirectly. So if we use the word stakeholder, all of those are stakeholders. Some of them are direct users, some of them are indirect users. And then on the other end, you have the gaming company, which has some expertise, of course, on the software, has a lot of expertise on the software development side, designing games, but not necessarily the scientific expertise to understand exactly what needs to happen. And you sit in between those two groups and you have to translate back and forth in some ways. So how does that work? What are the skills you had to develop from scratch through lots of experience and trials, I guess, to do this? What's the hard things here that you had to learn how to do?
Yeah. So that's a great question. And I have to say that, those were some of the early lessons learned. Shell Games, who again has been our major game development partner, it is an incredibly talented, skilled group of folks, and who really, know how to put on their scientist cap. But when we first started our original game project with them, and sort of bringing together these two groups of behavioral scientists, medical scientists, and folks at Shell Games, it was that issue around translation. How do you take, we can be considered the content experts, but it's not just content. It's not just content that you need to drop into a game. We're talking about behavior change, right? We're talking about change, about how do we get kids to think about things differently, learn information, accurate information. How do we help them have correct perceptions about different risks in their life? And how do we help them change their behavior based on all of those things? So it isn't as straightforward as like, oh, here's the content, just drop it in the game. It has to really do something. We have to see the game do something. So I'll give you an example, which I still love, and it was such a lesson learned. So we were probably about 6 months into that game development process. And one of the mini games, so our games typically are composed of a number of, they're highly sort of, narrative kind of graphic novel style. They have a sort of series of stories that we call challenge stacks, because those are the stories that the player needs to sort of navigate their character through, and then those interface with a number of skill-based mini games, which is where they really sort of practice the skills and learn the skills. And so one of the mini games we typically have in all of our games is one that focuses on refusal and sort of refusing risky situations in a way that, the character saves face. They save their position in their social group. Anyone can say no, but if you feel like you're going to be alienated from your friend group, you can't just say no. So we typically have this, a refusal mini game, which is basically, if you think about it on a high level, helping the player navigate through sort of difficult, risky, challenging situations so that they don't end up, running into a problem. So this was sort of the high level description to the game development team. And so what they then came back with, and again, our first game was developed on the iPad before the iPad was actually officially released. So it was sort of very novel and exciting to be using this new device. What they came back with, which was beautiful, just sort of a very brief prototype for the iPad, was a representation of how they interpreted this refusal mini game. What they created on the iPad was a version of the Labyrinth game. And I don't know if you guys know the Labyrinth game. This is the big wooden box that you tilt it so that the marble doesn't fall, like you have to guide the marble without it falling into one of the holes. So sort of, very high level theoretical, it was that same idea of, avoid falling into the hole by, kind of, really tilting the iPad, and so it was beautiful and it was brilliant, but it had nothing to do with the cognitive training we were looking to help the kids gain skills in. It was all about like hand-eye coordination. And so at that point, we just had to put a major pause and say something is just not getting through, like something we are not communicating well, it is not getting through. And so we took a major pause, and what we ended up doing was then, and we've done this with each game project since, is we created what we call our gameplay manual, or our gameplay book is what we call them. And these are documents, for each game that are upwards of 20, 30 pages that specifically around each of our mini games outline all the components of that mini game, the theoretical constructs, what we call the player transformation goals, what we want to see, changed in our player, the science behind it. And the goal of the game playbook is to they're intervention manuals. So it's like what we do with, science. When you go into the lab and you run an experiment, you have a manual that you can document exactly what you're looking to do and exactly what happens with that experiment. And so it really struck me that we needed that type of a document, which became a living document between the two teams, to be able to communicate and make sure we were literally all on the same page, that what we were trying to accomplish was to change the way kids think, not the way they, not sort of, as you can imagine, the Labyrinth game has a totally different, translation. So that was a big lesson learned. And since then, our path of communication and translation has just been, really optimized.
Dr. Fiellin, this is awesome. And the impact of these games is like so cool. And it's great to hear how many kids have actually taken them. I was wondering if you could talk a little bit about some of the extensions of the PlayYBL like gaming group that you're creating and any of the other areas that you're thinking about developing in. And then kind of on that topic, whether you see these games as purely interventions or if you could imagine them going beyond that to be more of like a, so something that you don't need to be at risk in order for this to be something recommended to you.
Yeah, so thanks, Bryce. So for the first question, so PlayYBL again is really focusing on sort of the marketing and distribution or implementation, dissemination, if you will. The lab is still obviously very actively, working on, we just finished this game and thinking about, future games. One of the real assets of this most recent game, Play Smart, is that while the focus, sort of as part of the HEAL initiative, which stands for helping to end addiction long term, is, the focus is on opioid misuse, but we really took the opportunity to focus on mental health promotion. So there are 2 stories in this game that focus entirely on mental health promotion, a mini game called Stress Sense that focuses specifically on mental health. So not only do we know that there's a lot of overlap between mental health and addiction, so you can't really address, you can't address one without some, some view of the other. They don't occur in a vacuum. But also it gives us the opportunity to also now pull out some of those modules, if you will, that are focused on mental health and create a whole new freestanding game focused just on mental health, which I think is, as you guys will talk about, is an area that just, desperately needs dedicated attention. So that's sort of my next hope, is to sort of take those parts out, creating a new sort of spin-off game, if you will, focused on mental health. So that's, but again, the sky's the limit. I mean, there's so many, I was just speaking with somebody out in California who wants to develop a game focused on, first year college students' experiences and how they can navigate and negotiate situations, in that specific, life experience. And I forgot your other question. It was a good question. I got all wrapped up in new games.
No worries. It was about whether you see these as purely interventions or if there could be, yeah.
Right. So a couple of things on that. So first, the way I see, so these are really public health interventions, if you will, meaning that we don't typically screen, our player or our participants. I sort of see folks really from, from the from early age up through 26 to be high risk, right? And so, so it's coming in with that we really don't sort of necessarily just, include kids who are at higher risk. We just sort of assume they're all at risk. And so it's much more kind of a broad public health initiative. I think when I heard you start asking that question, where I thought it was going was that we're also starting to look at these games as a way to, as assessment tools. So, each of the game software collects an enormous amount of what we call gameplay data. I mean, millions and millions and millions of log files that talk about everything that the player does in their game, all the choices they make, how long it takes them to make those choices, where they went at the branch points. And so I think there's huge potential. And we published one paper on this, starting to kind of look at all this data, these data. I think there's huge potential for these games to tell us something about, as potentially as a proxy, telling us something about what kids do in the game as related to what they might do in real life. And, moving from there, potentially be able to use design sort of them as a predictive tool to be able to identify kids who might need extra help, might be, at higher risk, just by using the game as an assessment tool along with as an intervention.
Okay, so let me ask maybe one last question for Lynn, and then we'll transition to hear from what Bryce and Ting are doing. And I guess if you think about all of your interactions with software engineers and software developers and all of that, what would you wish they had known when they start with you? I mean, you work with many of them all the time, and you almost have to train them to work with you in the same way that they have to train you to work with them, right? You have to understand it. So what is the advice that you would give to somebody who's starting to be a software engineer in this field, a software designer in this field, so how they work with people like you and other folks who do medical and public health research? Like, what are the things they don't understand in the beginning, and what is that they learn over time? The good ones, obviously.
Yeah. So again, and a major shout out to the folks at Shell Games, because they really have risen to the occasion, and a lot of this they know off the bat. I think that there are a couple of things. One is that knowledge is necessary but not sufficient to really have change. So it's if you're designing a game to just teach kids historical facts, that's one thing. That's really knowledge. But if you're trying to create a great game that helps kids have a different perspective about history, or their sense of self-efficacy about learning or understanding history, that's a whole different level. So I think some of it is sort of saying to them, software developers at the beginning, that knowledge, you have to have the knowledge, but you have to go way beyond that to really have impact. And so to really be thinking about what are the elements of behavior change, and they're very well established strategies in science around behavior change. So, I have taken on the responsibility as a scientist to share all of the, those papers and those, theoretical constructs with software developments, with the hope that they do a little studying, because we can help guide them, and we can help sort of lead them down the right path. But they also sort of need to understand what it is that we're getting at, and how these well-established theories, are there because they've had years and years of science behind them, and we need to use them in order for these games to be effective. So I think it's just it's and a real willingness and readiness, which Shell always has been, to communicate, to learn, to be open to the different disciplines, and I look to them to say, what can be done, what does make sense, what do kids want to do, because they're the ones that need to make sure that kids want to play this game and that it's compelling and it feels like a game. So it goes both ways in terms of the education.
Mm-hmm. Yeah, we could ask the opposite question. What surprised you the most about them? Like, what did you learn from there? Like, was there something that this couldn't be done? Oh, this is easy. Or was there something, oh, I should be able to do this? And they come back and say, this is almost impossible to do. Was there any moments of that nature? Because it's this process of, it's almost like a multicultural team, right? You have to learn each other's language, each other's culture. That's part of the process of working with folks like that.
Right. And fortunately, and you're right, and the language, quite honestly, isn't just between, and this is really an important thing to note, isn't just between the scientists and the game developers. So it's our team designers, right? It's the adolescents that we work with, because you know what? They keep us in line. And we're a bunch of grown-ups, and we really we haven't been, teens for a long time. And so they're the ones who come back and like, okay, no teenager says that. No teenager wears that. No teenager would ever do that. And that's, if you really think about the triangle that we form, their input, their voice is absolutely critical to keep us all in line. So, the game developers can think what they think and we can think what we think, but ultimately it's the teens that's what counts the most. Because if it's not authentic or real to them, it's not going to have impact. So they keep us in check. So that communication is also absolutely critical.
Okay, so before we transition to hear from Bryce and Ting about their current work, was there anything else you wanted to mention that you wanted to say, or was there anything else that we missed here before we transition to the other discussion?
No, I think you covered some of the key things. Absolutely.
Okay, thanks. So we'll switch over and let Bryce and Ting tell us a little bit about the email that both Lynn and I received one day saying, oh, this is what we've been working on. So we'd love to hear a little bit more about the project you're involved in and perhaps even show us a little bit of a demo as you go through with that. Thanks.
Sure. Yeah, so just to set the stage, about a year and a half ago, my younger brother Chase took his own life after struggling with mental illness for a number of years, it's a terrible thing to go through, and created a lot of energy in my family and in our community to try and do something positive, and to turn that tragedy into action. So in the wake of his passing, we set up a foundation in his name, and we did a lot of research into mental health and into the science behind it and where some of the biggest gaps in the space are. What we found was actually pretty shocking. The prevalence of mental health in adolescents, it's about 1 in 6 adolescents has a diagnosable mental illness. And the most shocking statistic of them all is that 76% of lifetime mental illness emerges in adolescence. So, the vast majority of people that struggle with mental illness, that starts in adolescence. And for how prevalent that is and how big of an issue it is, the resources and education that schools provide, that parents receive, that students receive is just so lacking. And that comes from a bunch of different things. It's a stigmatized topic. It's a sensitive topic. It hasn't really been brought to the foreground the way that other things have. So we decided to make really the mission of the foundation we established for my late brother to promote the education and awareness of mental illness, and specifically to try and focus on this issue of brain health, to try and make the concept of mental health, mental illness more kind of physical and feel more treatable for people. Because the truth is that, if you can catch this early and get on the right treatment course, these are livable diseases. These are things that you can cope with and you can manage like any other chronic illness like diabetes. So that's kind of the stage that was set in our community and for us. And we decided to make one of the first things that we were going to develop, a BrainHealth Bootcamp, which is a program basically for schools to roll out to their students and to their families and their faculty, to just make them aware of these brain health conditions, the fact that they emerge in adolescence, and to give them some kind of directional support on what to do if they notice that in themselves or in their community. So
I'll give a little bit of context because I'm just sitting right here. But Bryce and I worked on a project through your class, Xenios, and also with Dr. Fiellin. And we had been working on a project that was also related to mental health and brain health. And we both care very deeply about mental health. And I've had people in my family, and myself included, struggle with mental health. So both we're very passionate about this project and this space. And one of the things that we experienced at Yale was this kind of alcohol awareness program that everyone as a first year had to take. And it was like a 30-minute course where it was mandatory, which was less fun, but we were taken through like a series of videos and quizzes and things like that. And at the end, one of the, I think, defining pieces of insights that we got that was really important was that we understood Yale's policy about alcoholism and what to do about it, and also where to go, where to seek help if you have a friend that's struggling with alcohol abuse, or if you are yourself. So we wanted to kind of take those kind of nuggets, or like these experiences that we had with the alcohol awareness program at Yale and kind of transfer that into something that would help adolescents and kids in high school to kind of learn about brain health and in this kind of guided way. So that's how the Brain Health Bootcamp kind of came about. And we'll give a short demo. So we'll share screen. Is that okay? We can do that.
Yeah.
So this is still a work in progress.
Yes, we're still in the early days, but
yes, and we've been working very closely with Dr. Fiellin to make sure that this content is accurate.
Yeah, and we're also working closely with some of our pilot schools, namely the Waldorf School of Massachusetts Bay, which is pretty close to where I grew up. And so on the topic of like working with users, we have a similar kind of situation where we have two different types of stakeholders. There are the students who actually take the guided program and who are benefiting from the information, but there's also the school, which is more of like a direct customer. So that's kind of the party that we really need to like kind of build towards without losing sight of the impact on students.
Mm-hmm. And we've also been talking to a lot of students and parents and getting their input and figuring out how they learn best.
Yeah, so the Brain Health Bootcamp is composed of this resource library, which walks through the conditions and provides kind of supplementary information so that if you wanted to learn more about a specific kind of brain disorder, you could go in here, figure out what it is, science behind it, some warning signs, common misconceptions, and then treatments. And it's important to note we're actually not creating this content, we're more curating this from vetted sources. But this is the kind of directory and resource library part of it. But we're also building out this guided program, which we're going to be rolling out with Waldorf, and we're still finalizing if there will be a few other schools in that pilot. But this is, like Ting was saying, a similar thing to the alcohol awareness program. It's meant to be completed 20 to 30 minutes. It's supposed to be just a high level context setter for this. And this is still a work in progress here, but you can see that it gets stepped through.
So just to reemphasize, the bootcamp itself, it's like a 2-part full program. So what you first saw with the online directory is just this, information repository that's like detailed and curated for, greater accessibility, et cetera, for people to kind of explore mental health conditions and really get into it if they choose to. But the guided program is something that we're trying to distribute to schools and have them kind of add to really kind of part of their curriculum or part of like maybe first year orientation or something like that. And so it's broken into a couple of key components. So we have units that are, so there's the introductory unit. Then we introduce this concept of kind of equating mental health with brain health, or transitioning from talking about mental health to brain health, and warming students up to this idea that mental health is very closely linked to your brain, and it is, as Bryce said, something that can be diagnosed and treated, and most importantly, managed. And then we kind of go into depth about the brain health conditions, and then most importantly, how to navigate conversations about brain health. Like what are the signs? How to talk to a friend who might be struggling, and also at the very end, generally, how to have, how to live with good brain health habits. And so each of these units come with videos that we've made, again, curated from information that is publicly accessible and has been vetted. And then we have follow-on quizzes, which I think is a really important element, because they kind of reinforce that knowledge and really test like, okay, did you pay attention to this video? And did you pay attention to this article? So those are kind of short burst little quizzes that we have. And the schools will also be able to collect this information, understand, and see if, make sure that the students are kind of, are actually engaged in this guided program. And
there's a lot of thing. Oh, sorry, go ahead.
Yeah, so I'm sure that, we'll put links to all this as you finish. Maybe you should stop showing your screen at this point so we can see you again. We'll put links to this. So I'll turn it over to Lynn and see if she has any questions or comments, and then I'll have some final thoughts too.
So needless to say, I think this is fabulous. And I think your approach is really, is not only novel, but really important for the field. So I kind of know the answer to this question, but it would be helpful for me to hear you guys articulate why you chose to sort of make this translation from mental health to brain health. Like what my sense is that was intentional. And so to hear from you, what the thinking was behind that.
Totally, yeah, it definitely was intentional. One of the things that we noticed as a driver for stigma around this was the kind of lack of distance between the mental psyche and people's perception of what mental illness is and actually the physicality of the illness itself. So, if you're struggling with something, it's easy for you to fall into maybe thinking that that's a character flaw, thinking that it's your personality. And so we wanted to try and reframe this as a more treatable physical thing, something that can be understood, that can be separated from who you are, to see the brain as an organ, and to be thoughtful in how we kind of present that. It was something actually, as my brother Chase was struggling, we had a lot of conversations about how you are not your thoughts, that you can experience thoughts, but those are not who you are. Those are not, those don't make you up. Those are a byproduct of your brain chemistry and your life experiences and whatnot. So yeah, we wanted to reframe that, really to try and change the conversation and to try to eliminate a lot of the stigma. We treat a lot of things we treat diabetes like it's a physical illness. We should treat brain health disorders the same way.
Right. And I think, being, a medical doctor and having had a lot of training in, around mental health and, brain disorders, brain health, I think that's absolutely key. I mean, not only because it is absolutely accurate, but also because I think it helps reframe the discussion, reframe the approach, and really, hopefully ultimately to abolish, the stigma associated with it. As you said, we don't attribute some failing to people who have, diabetes or high blood pressure. It's, and so, the issues around mental health are exactly the same as those other medical conditions, and really need to be treated. They have a biological basis. They have, successful treatment and management. They're all in the same group, and it's really important, as you're doing, is making it organ-based, just like other medical conditions are. So to me, that was one of the most impressive things off the bat when you guys introduced this idea, was that approach, because I think that's absolutely the first step to making everyone understand better and, feel more open about talking about it and helping people get, whatever, help they need.
Yeah,
absolutely.
So we've gone for about 45 minutes. I know people have other things to do. So thank you to all of you for coming on. Hopefully some of the students listening into a medical software class online will see that there are applications here that are worth pursuing. And so with that, we'll stop here. Thank you both so much. And I look forward to hearing about the great things that you all do in the future.
Thank you.
Thank you.
Thank you, Zenius.
Take care, everybody. Bye.